Dear friends, welcome back to the channel. In this video we're going to demonstrate how to do a direct chop in a wide, mature intumescent cataract. I find the massaging bubble technique very convenient in staining the anterior lens capsule because it evenly spreads out the dye over the anterior lens surface. For mature cataracts, my viscoelastic substance of choice is a cohesive one as it flattens the anterior capsule much better than the dispersive viscoelastics. So after making a triplanar 2.8mm incision, we are now initiating the CAPSULORHEXIS with a 26 gauge bent cystitome. So I'm aspirating some of the liquefied cortex with a 27 gauge cannula to reduce the intumescence of this mature cataract. And again I flatten the anterior capsule with a cohesive viscoelastic and begin my CAPSULORHEXIS with the Utrada forceps. These measures were taken to prevent any radial extensions of the CAPSULORHEXIS, as is often seen in mature intumescent cataracts. At about the 1 o'clock, I nearly had a radial extension, but I quickly pulled the capsular flap back towards the center. Mature cataracts generally rotate freely and do not require hydrodissection procedures, and we go ahead with the direct chop technique for the nuclear fractus of this mature cataract, and we are successful in cracking the nucleus into two heminuclei. I'm successful in getting a second chop or a second separation to create one nuclear fragment, and each of these heminuclei are further fragmented in a similar manner. The lack of epinuclear tissue compromises the stability of this procedure, but nevertheless we have been successful in cracking this nucleus into 5 or 6 smaller fragments, each of which will be now further emulsified. Dear friends, I'm using 70% phaco power pulsed at 35 pulses per second with a 60% cool time, and I use a vacuum of 450 millimeters of mercury with a 45 cc per minute aspiration flow rate whenever I'm dealing with a mature or a hard cataract. Dear friends, I'm using the Oertli Catarhex phaco machine, and I'm very comfortable using it when I'm dealing with these mature or hard cataracts. The flared easy tip is very good at holding the nuclear fragments once you've finished with the chop. Dear friends, I often use my white eyeliner or my second instrument as a secondary chopper to smash these individual nuclear fragments into smaller pieces. This affords me with greater control during the emulsification procedure. And generally I don't like to keep a sharp chopper in the anterior chamber. Once I'm done with the nuclear separation, I do so because the sharp chopper can inadvertently puncture the posterior capsule and cause a PC rent. Mature cataracts have a very flimsy posterior capsule for the reason that they've been stretched out by the increasing convexity of the nucleus, and hence they're thinner than normal. So very little cortical matter is left, and this is easily removed with the bimanual irrigation aspiration technique. Using a sandblasted aspiration cannula allows you to further polish the posterior capsule to remove any small cortical remnants or the leftover epithelial cells. We are now demonstrating a hydro-IOL implantation under continuous irrigation. So this concludes the case, my friends. Thanks for watching.